So in 2019, genicular artery embolization is a growing area of interest. If genicular artery embolization is proven to work for patients with osteoarthritis, that will have a potentially profound impact on the treatment of that patient population. At the present time, patients with arthritis, of which there are lots and lots, are managed conservatively with painkillers, physiotherapy and education programs. But then there's this real gap in the treatment paradigm of patients who aren't yet severe enough to merit joint replacement surgery but are failing these conservative methods. And so that's really where embolization fits in that space for those patients that have failed conservative methods but aren't yet severe enough to have a joint replacement. So genicular artery embolization is a minimally invasive treatment. It's done under local anaesthetic. It takes about an hour to do the procedure. So patients can go home the same day. It's very much like a lot of the treatments within interventional radiology, such as prostate artery embolization or uterine artery embolization, in the fact that patients like the procedure, and if the data long term is shown to be robust, this will have a profound impact on the treatment of these patients with neo-osteoarthritis. And we're obviously in the midst of an opiate epidemic, and again, if we can fit into that space with that treatment option, it will have a really positive impact on these patients' quality of life. The problem we have is that osteoarthritis of the knee is extremely common and can be very debilitating. The current treatment options are conservative, such as in the form of painkillers or physiotherapy, and then that extends to joint replacement surgery for those patients that have severe disease. So the issue we have within the treatment strategy at the present time is that there's a real gap in terms of those patients that are failing conservative treatment but aren't yet severe enough to merit joint replacement. And that's where genicular artery embolization fits. There's good scientific basis to the procedure of genicular artery embolization for knee osteoarthritis, based in terms of the laboratory experiments and animal experiments. And obviously Acuna and his group have done some great work publishing on their initial experience. And so from my point of view, running the Genesis study, which is the first European prospective trial looking at the treatment of mild to moderate knee osteoarthritis, we need to really push on now to get the community as a whole to look at this as a treatment option. And I think having presented here at ET and spoken to lots of interventional radiologists, I think the time really is now for us as a community to combine our efforts and really provide robust data on genicular artery embolization for knee OA, much in the way that we did for prostate artery embolization some 10 years ago. We're really at that point with the data, and I think the time is a really exciting one.